Hi everyone, this is Vignesh from Easy Way to Learn Medicine. So today we are going to see the Krok 1 anatomy topic wise explanation. Today we are going to see central nervous system and peripheral nervous system. So the first question: a patient premise of a medulla oblongata are damaged by tumor growth. As a result, the conduction of nerve impulses will be impaired in the following pathway. So they gave you five options. The first two are a pyramidal tract, and the last three, which is extrapyramidal tract. So for that, you need to know all about the ascending tract and descending tract. All you need to know about pyramidal and extrapyramidal tracts. So why it? Because corticospinal tract, because it crosses the premise of the medulla oblongata. So you can see in the pyramidal tract and extrapyramidal tract differentiation. The lateral and ventral corticospinal and corticobulbar tracts are present in a pyramidal tract, which is located in a precentral gyrus, which directly descend from the cerebral cortex to spinal cord. So you can see the functions: fine movement for a lateral corticospinal tract, for a ventral postural movement. So it crosses the pyramid crosses the medulla oblongata. So if it is damage of a medulla oblongata, there will be damage of the pyramid tract also. So the answer will be corticospinal tract. A 64-year-old woman presented with disturbed fine motor function of her finger, marked rigidity, and tremor. She was diagnosed with Parkinson's disease. What brain structure or damage resulting in disease? So Parkinson's disease, there is a decreased synthesis of new dopamine, which is a neurotransmitter. So by the structure called substantia nigra, which is helpful to synthesize the dopamine. So there will be damage to the substantia nigra. As a result of post-encephalitis, a man has developed an increasing in cerebral fluid pressure in a right lateral ventricle. What can be causes of this condition? So you can see in this image, there will be secretion of cerebrospinal fluid from the lateral ventricle and passes through interventricular foramen and it goes to third ventricle. So there is a pressure increases in the right lateral ventricle. So there will be a blockage in the right intervertebral ventricular foramen. There is a block. There will be increasing pressure inside the right lateral ventricle. So there will be blockage in the right interventricular foramen. Fourth question: Parkinson's disease. There will be damage to substantia nigra. There will be decrease in dopamine neurotransmitter. Fifth question: a child diagnosed with purulent inflammation of a middle ear was brought to the ENT department. The disease started with the inflammation of the nasopharynx. It was determined that the infection had reached the tympanic cavity through the eustachian tube that is located in. So they asked, where is the eustachian tube located? Also, inflammation started in nasopharynx and it reached the tympanic cavity through the eustachian tube. So we know there is a connection between nasopharynx and the ear through the eustachian tube, the canal called tensor tympani and eustachian tube. We call it as canalis musculotubarius, which is presented in a petrous bone. The bony canal in a petrous bone, the canal for tensor tympani muscle and the eustachian tube. We call it as canalis musculotubarius. As a result of continuous chronic encephalopathy, a patient has developed spontaneous motion and disorder of torso-muscle tone. These are the symptoms of following conduction tract. So torso bone, upper body, which is like a trapezoid in the back. Why? Because tractus rubrospinalis, which is the extrapyramidal tract, which control for the tone of flexor muscles of upper body. So especially this tract helpful to control flexion and tonus of a upper body muscles. Also, you can read other options Y, which is not a correct answer. So, for example, corticospinal tract, which is a pyramidal tract, which is used for control voluntary movement of a body and limb, like fine movements. For flexions and tonus of upper body, the tract, which is extraabdominal tract, which is tract rubrospinalis. In the course of experimental, thalamocortical tract of animal were cut. What type of sensory perception remain intact? Olfactory. Olfactory, which is a sense of smell, which the cranial nerve, which is for sense of smell. All other sensory perception, which is has a center in a thalamus. Only olfactory does not present in the thalamus. The centers, olfactory centers, which does not present in thalamus. All other has a center in thalamus. So if you cut the thalamus corticotract, also there will be working of olfactory centers because olfactory centers does not present in thalamus. So there will be working of olfactory centers, sense of smell. A patient has a damaged spinal cord white matter in the middle area of a posterior white column, disturbed proprioceptive sensibility of a lower limb joint and muscle. What fibers are affected? So for that I told you, please read ascending tract, descending tract. Fasciculus gracilis and fasciculus cuneatus, which is present in a site of origin T5 T4. Fasciculus gracilis posterior and fasciculus cuneatus also in a posterior funiculus. And the fasciculus gracilis terminated in a gracilis nuclei, fasciculus cuneatus terminated in a cuneate nucleus. These help in a proprioceptive function and a fine touch sensation of a trunk and limb muscle. Also, like proprioceptive, vibratory sense and movement of the joint, sense of a movement of a joint. So in a question they told like disturbed sense of a lower limb joint and muscle. So there will be fasciculus gracilis damaged. So this helps in a proprioception sensation from lower limb joint and muscles. So please read about all the tract. A center under study provide transfer of information to the cortex without thalamic involvement. This is a repeated question. Olfactory center does not present in thalamus. All other or have center in thalamus. So without the thalamus, olfactory can work individually. As a result of injury, the integrity of anterior spinal cord root was broken. What neurons present in it? So anterior spinal cord, there is a presence of motor neurons. In the ventral spinal cord, there is a presence of sensory neurons. So if a damage of anterior spinal cord root, there will be damage of axons of motor neurons because it present in a anterior spinal cord. If it is damage to the ventral spinal cord, there will be damage of a sensory neurons, axons of sensory neurons. On the examination, a physician revealed inflammation of a second branch of a trigeminal nerve. This branch come out through the following foramen. So second branch of trigeminal nerve come out through round foramen. It goes through the skull by the supraorbital foramen. Please note it down. Second branch of trigeminal nerve comes out of the skull through the round foramen, foramen rotundum. The branch grows through the skull by the supraorbital fissure. So you can see in the image, ophthalmic branch goes through supraorbital fissure, maxillary branch goes through foramen rotundum, mandibular branch foramen ovale. It second branch comes out through the skull by the foramen rotundum, goes through the skull, which is supraorbital fissure. Don't be confused. Comes out of the skull foramen rotundum goes through the skull, supraorbital fissure. These questions they are asking repeatedly many times, so please read the question carefully and answer. A patient demonstrates function loss of nozzle half of the retina. What area of the visual pathways is affected? Nozzle half of retina means in a nozzle side there will be loss of a vision. So patient cannot see at the nozzle bottom. So what will be damaged? So in optic chiasm there will be a crossing of a fibers. So if it is damaged, there will be damage to the nozzle retina. So the patient will be loss of a nozzle part of a vision. So the option will be optic chiasma damage. To damage the causes of loss of nozzle of retina. So the same question goes through second part of a trigeminal nerve goes through supraorbital fissure. After a case of a cold, a patient developed a acclimation disorder. This disorder was caused by a functional disturbance of a following autonomic ganglion. So for the lacrimation, so for a lacrimal gland, you have to know supply innervation of the lacrimal gland. For the lacrimal gland, there is a parasympathetic ganglion innervation, that is pterygopalatine ganglion, that is a parasympathetic ganglion which is synapses with a great petrosal nerve supplies lacrimal gland and nasal mucosa. So if there is a lacrimal disorder, there is a damage to a parasympathetic ganglion, that is a pterygopalatine ganglion. So you can see in the image pterygopalatine ganglion synapses with a petrosal nerve and it innervates the lacrimal gland and nasal mucosa. Due to trauma, a patient disturbed the function of a parotid gland. What now ensures its secretory function? So it's a direct question. For the parotid gland, there is an innervation nerve petrosus minor. It supplies the parotid gland. It's a branch of a glossopharyngeal nerve synapses with optic ganglia. A man arrived in a traumatological department with the trauma of a right shoulder with a displaced humeral shaft, central part. We have a head and neck, and there is a central part. We call it as shaft. The shaft fracture on the right one third of a humerus. The patient cannot extend the finger of his right hand. What now is damage? So you can see the radial nerve courses. It has fused branch to in the foramen for a motor like motor innervation. Brachioradialis, extensor carpi radiali brevis, extensor carpi radiali longus, and supinator muscles. And the posterior interosseous nerves innervation, all the extensor muscle and the abductor, one of the abductor muscle. Patient cannot extend for all the extension muscle innervated by a radial nerve. So the radial nerve which innervated the dorsal extensor muscle of the wrist, hand and finger. So they told the patient cannot extend his finger due to the fracture of a humerus. The radial nerve which innervates the extensor muscle of the wrist, hand and fingers. So you can read the other options why it cannot be correct. So it's the same question, functional loss of a nozzle of the retina. There is a damage to the optic chiasm because the pathway of the crossing of the fibers, optic fibers. A patient lost sensitivity of a little finger, what now mostly damaged. So you can see in the image here the sensory pattern of a little finger is innervated by a ulnar nerve for a ulnar nerve innervation. Skin over medial surface of the hand through the superficial branch. Ulnar nerve carries sensation from anterior and posterior surface of the middle one and off fingers. Little one. So you can see the image. Little finger, the next finger of the half of the finger. You can see in the image. Patient has tumor of eye socket tissues behind the eyeball. Disturbance of accommodation and pupil constriction is observed. What anatomical structure is damaged. For the accommodation and pupil constriction, muscle we need is iris sphincter muscle and ciliary muscle. This helps in accommodation and pupillary constriction. For the pupillary dilation, we call it as iris dilator muscle. For pupillary constriction, iris sphincter muscle and accommodation ciliary muscle. For this muscle, the supply called ganglion ciliary, which is a parasympathetic ganglion which is located behind the eyeball, which supplies the sphincter, iris sphincter muscle and the ciliary muscle. The repeated question: second branch of the trigeminal nerve goes through the skull through the supraorbital, which comes from foramen rotundum. As a result of a road accident, a 35-year-old female victim developed urinary incontinence. What segment of a spinal cord are damaged? So she cannot control the urinary bladder. So by the segment S2 S4, there is innervation to the urinary bladder, kidney, rectum, and genital organs in sigmoid column. A patient consulted a doctor about being unable to abduct his right arm after a positive trauma. Examination revealed passive movement were not limited. The patient was found that have atrophy of a deltoid muscle. What now is damaged? Atrophy means shrinking of a deltoid muscle. What now is damaged? At the level of a deltoid muscle region, there is a muscle called there is a nerve called axillary nerve, which innervate the trapezius, long head of triceps nerve, and teres minor and deltoid muscle. Due to innervation damage of the axillary nerve, there will be atrophy of a delta nerve, teres major, and triceps, long head of a triceps muscle. After a trauma, upper third of anterior forearm, a patient exhibit difficult pronation, inward rotation, weaken of a palmar flexor muscles, impaired sensitivity of the 1, 2nd, and 3rd fingers. What now is damaged? So you can see in the image in the sensory distribution, skin over anterolateral surface of the hand. The 1st, 2nd, and 3rd finger, there is a sensory distribution by the nerve called nervus medianus. On examination, a patient have medial strabismus. The height goes like at the nasal point. The inward deviation of the eyeball and unable to abduct the eyeball outward. Abduct, abduction. Now, what now is damaged? Abduction. So for that we have to know the muscles and its innervation. Lateral rectus abduction, medial rectus oculomotor, superior rectus and inferior rectus oculomotor, superior oblique trochlear, inferior oblique oculomotor. You have to know the functions. For the lateral rectus abduction now, function abduction. From medial strabismus, there will be a damage to a lateral rectus muscle that causes medial strabismus. Now which innervate the lateral rectus muscle abducent. The same questions, second branch of a trigeminal nerve comes out from the foramen rotundum, goes through the skull, which is supraorbital fissure. Same questions, thalamotractical work at what sensory perception remain same. Olfactory does not present in thalamus, all other have a centers in thalamus. If you cut thalamus also, there will be a olfactory working, sense of smell. Same question repeated. After a case of a common cold, a patient developed numbness of the right side of a face. Examination relieved disturbed pain and thermal sensitivity in the right of a face. For the sensory innervation of a face, there is a trigeminal nerve which innervate the facial muscles for the sensory innervation. If it is paralysis, if it is a paresis, we can say it is facial nerve. Trigeminal nerve carries a general sensation from the face and mucous membrane and anterior two-thirds of the tongue. For example, thermal, pain, temperature, and all other things of a face muscle, that is a trigeminal. For example, paralysis of paresis, we can say facial nerve. See, paralysis of a facial nerve by the damage called facial nerve. It supplies mimic muscle, lacrimal gland, submandibular, sublingual, nostril glands. A patient with a wrist trauma, the clinician presented to a damage to a nerve that passes through the carpal tunnel. Name this nerve. Through the carpal tunnel, only nerve which passes through is nervus medianus. After a trauma, a man lost skin sensitivity on a lateral surface of the foramen. What nerve of brachiocephalus provides sensitivity of the affected arm? So you can see in the image lateral surface distribution for sensory innervation by the nerve called musculocutaneous nerve, which have sensory innervation to the lateral surface of the foramen through lateral antebrachial cutaneous nerve from the brachial plexus. So this is all about the peripheral nervous system and central nervous system questions from anatomy, Krok 1. So thanks for watching. Thank you. We continue to other part. Thank you.